Hello everyone. So this is question 2 of our 100 clinically oriented anatomy question. Let's get straight into it. It says a 23-year-old man is admitted to the emergency department with a deep bleeding stab wound of the pelvis. After the bleeding has been arrested, an MRI examination gives evidence that the right ventral primary ramus of L4 has been transected. Which of the following problems will most likely be seen during physical examination? Reduction or loss of sensation from the medial aspect of the leg, loss of Achilles tendon reflex, weakness of abduction of the thigh at the hip joint, inability to evert the foot, reduction or loss of sensation from the medial aspect of the leg, and loss of Achilles tendon reflex. So let's go through the question and check what we have. It said the right ventral primary ramus of L4 has been transected, and that is the only information we were given. And now let's discuss how L4, how it's going to affect the lower limb. So the L4 majorly innervates the medial aspect of the leg and medial aspect of the dorsum of the foot. So yeah, that is the major skin that the L4 innervates. So yeah, and of course the nerve that supplies those places is the saphenous nerve, by the way. So yeah, it's the saphenous nerve, and the nerve root of the saphenous nerve is the L3 and the L4. The L4 being predominant, all right. So the L4 is the major cutaneous sensation that the saphenous nerve provides to those regions, that is the medial aspect of the leg and the dorsum of the foot. So having said this, we can easily wrong out some options here. Option B is loss of Achilles tendon reflex. The Achilles tendon reflex is majorly controlled by the S1 and the S2 spinal nerve, predominantly by the S1. That is the Achilles tendon reflex, predominantly by the S1. Weakness and abduction of the thigh at the hip joint. So the major muscles responsible for abduction of the thigh at the hip joints are the superior and inferior gamelli muscles, the obturator internus, and the upper fibers of the gluteus medius and the gluteus minimus, acting as the primary abductor of the thigh. And the innervation to these muscles are basically L4, L5, and S1. Those are the major innervations to these muscles, and not predominantly L4, predominantly L5 and S1. Now, inability to evert the foot. Going by the major myotomes that I listed under here, eversion of the foot is controlled by L5 and S1. L4 does not even take part in the myotome, so that is definitely out of our option. So option B, option C, and option D are out of the game. Option E now, we have reduction or loss of sensation from the medial aspect of the thigh and loss of Achilles tendon reflex. We initially established that the Achilles tendon reflex is controlled by the S1 and the S2 spinal nerve, predominantly by the S1 spinal nerve. So that is not the correct answer. So going by what we have, option A is the correct answer. Remember, we initially established that the L4 predominantly innervates the skin on the medial aspect of the leg and the medial part of the dorsum of the foot. So option A is our correct answer. So option A here is our correct answer, and I believe you understand why other options are wrong. So I'll see you in the next video. Thank you for tuning in.